So I've been walking the streets of Zurich for a few hours because I arrived and my room isn't ready yet. I'm also on my second latte. This one's like heavy foam, but desperate times call for desperate measures because the jet lag is real. But one of my favorite things to do is to travel, and one of the things I love about metropolitan areas is the amount of people watching. And I don't mean like people watching like what they're wearing, but I mean like watching their gait and mechanics, right? So from walking and sitting and standing and getting up from sitting. There was a gal over at one of the church steps who was doing one-legged squats, and I was watching her knee tracking, and it got me thinking that a lot of us watch, use visual assessment, and we watch patterns. And here, let me give you a quick view real quick so you know what I'm looking at, because I keep looking up and seeing all the goodness that's here. This is probably the busiest, loudest corner in all of Zurich, which is ultimately really quiet, but I chose this spot so that I wouldn't disturb anybody by talking on the live. So anyway, one of the things I love about watching mechanics, and that I like practitioners to do, is not only just use visual assessment to see if something's off, but then to take it to the next level. Like, what mechanically do you see is off? Can you call it out by name? Do you know the joint action that's off? Do you know the muscle that's supposed to be working? Do you know what compensatory pattern is that you're seeing because you see that something's off, which means it's not a functional pattern, it's a compensatory functional pattern? Can you see what's off? Can you name it? Can you see what is being compensated? And then do you know the implication, the mechanical implication in the body? And hey, Chantal, do you know we're on similar time zones. That's why you're here with me now. I think everybody back in the States is probably still asleep, so you guys will catch this later. But thanks for being here with me, Chantal. So do you know what you're seeing? Do you know the joint action that's supposed to happen? Do you know the muscles that are compensating? Do you know the mechanical implication for that compensation? Are you seeing what's actually the compensation pattern, or are you seeing the mechanical rollout of that compensation pattern? And then can you, in the same moment, list clearly in your mind what's needed to correct it? Hey, Dolly, I love it too. I can't wait to see you soon. And the reason I ask this of you practitioners is because oftentimes we'll see something with our client, we'll be like, oh, that's really off. And then we get to start working on it, and sometimes the best we offer is, oh, that's really tight, or that really, you need to stop doing that. And I appreciate that you guys can see what's up, and it stresses me that we don't have a more clear answer. You don't need to tell the client something's off. They know, they're uncomfortable. But can you, in the same moment that you're spotting it, also have clarity on what you get to do about it? Not what they're doing wrong, but what you get to do to remedy it. I'm asking this question because it's literally how we train in the method, right? Like, yes, there's a whole method and there's a whole bunch of tools and things that go with that method, but to be able to utilize that, you've got to also train yourself to think about what you're seeing and what's needed on the spot. Because that's basically what's happening when your client walks in. They walk into your treatment setting, whatever that is, a gym, a studio, a private office. They're walking in and they're already telling you something about their body, even if you're a manual practitioner. I remember my first orthopedic setting. I worked in a orthopedic physician's office, a network of offices, and I was the head therapist there, and we had like 10 to 15 minutes with each patient. It was a bum deal, but I got efficient, right? And so in those, like, every second of those 15 minutes really counted. From the time that I went to the waiting area and spotted my client seated, I'd have to register quickly what posture are they choosing when they sit, but why are they choosing that posture? Why does that feel restful in that body? And what's needed instead? Not just, optimize the posture, like, obviously, but why is that client choosing that posture? What does that mean? And so then that tells me what their treatment requires as well, which isn't just optimize their posture. Everybody knows they need to have better posture, guys. Like, we get to do better than that. I don't just tell someone to sit up straight or stand straight or walk better. They already know that, but they don't know how, because there's a pattern inside their mechanism that is compensating for something else. And we need to be able to rewind the tape all the way back to that and be like, I know why that seated posture feels comfortable for that person. I was watching someone jump roping on Instagram a couple weeks ago, and it wasn't slow speed or anything, but I was watching their legs hit the ground and come back up again, and literally their legs were doing two different things. Great that we can spot that. However, why is that happening, and what does that person need to do differently? You're not going to change it when they're moving that fast. Fast patterning, fast movement, phasic action, that's not where you change patterns. So we don't want to just tell them to walk differently, jump rope differently, swim differently. You got to break that down because there's a neuroplastic memory. Anyway, I feel like I'm getting into a training session here, but I just wanted to, I was thinking about this because I'm spending my time looking at this beautiful city, but also like can't help watch all the mechanics. And why does that light me up? Because I'm literally running treatment plans in my head. Like, I know if I had a chance to talk to any of these people, I could literally help them in 15 minutes. That's what I was trained to do. It's also what I train you to do when you come work with me. So there might be a lot of knowledge that you have, but then the implementation of that and the expediency in which you reach that conclusion is also part of master level. So I want that for you guys. All right, I'm gonna go back to people watching. You have my attention, but only part of it. I also need to get this caffeine into me so that I can stay awake because I am training tonight. So I'm gonna go back and enjoy this beautiful city. If you guys are on my time zone this week, let me know. I'm in, as I said, I'm in Zurich, so I'm 6 hours ahead of where I usually am. And I'd love to connect with you guys in real time if we're in the same time zone. All right, I'll see you guys next time. Bye for now.